washing my hands. Hi, my name is Aisha. I'm a student nurse from Harper College. I see that your doctor has put in an order for a uterine insertion of urine catheter, so I will be performing that. I'm using a baby doll for my insertion because I could not work with the pillows. So this was my patient today. So first I would identify the patient, ask for their name, their date of birth, and make sure it's the correct patient before performing the insertion. Next, I am going to ask my patient to be in a supine position with their knees flexed and feet flat on the bed, and have their thighs relaxed and rotate externally. And so this is what the position would look like. So I have room to work with in that area, the perineum area. Next, I am going to drape my patient. So I'm going to make a diamond out of the blanket and cover it up and wrap it around their thighs. Next, I am going to perform hand hygiene and put on some clean gloves. Then I'm going to fold under the blanket. Fold the blanket so I'm only exposing the perineum area. Next, I'm going to clean the perineum area using these perineum pads. And you could also use towels that are soaked in saline water. So we're gonna pat it dry. So first, I'm gonna wipe the farther thigh, then dispose, then do the thigh that's closer to me, dispose, then the labia that's farther, dispose, labia on this side, dispose, and then. Also, I do have a garbage, or you can have a biohazard bag on here next to you. Then I'm going to take my gloves off and perform hand hygiene. Next, I'm going to set up my kit, my clean kit, sterile kit. Okay. And I opened it. Actually, I'm going to reopen this. So I would want to open it first farther away from me. So, and not going over it. So open that, then open the two sides and open the bottom. I have the 1-inch border that I can use it to move it around. So I'm gonna move it around like this. Then I have my sterile gloves. I will put it to the side. Next, I want to drape the patient underneath. So I'm gonna grab this. I would have to, for right now, because it's a doll, I would have to lift up the feet to put the drape underneath the patient. But if my patient was a real human being, I would ask the patient to lift up their bottom and slide the drape underneath. So I'm going to do that, and I'm going to have the shiny side underneath. So since I don't have my sterile gloves, I can only touch the corners of it. And I'm going to have my patient lift up, drape them, and that's it. And have them keep their legs apart, okay? Next, I'm going to put some hand sanitizer on again, or perform hand hygiene, and put on my sterile gloves. For my sterile gloves, I need to make sure that I don't break the sterile field. And with that, I need to also keep my hands above my elbows. Alright, so I have my sterile gloves on. Next, I'm going to drape my patient. So I can touch any of this for right now because I have sterile gloves on and this is a sterile field. So I'm going to open up my drape and only expose the perineum area. So I'm going to open that up, and you can move it around because it's sterile. Next, I'm going to set up my sterile field. First, I'm going to move the box a little closer. Okay, so I'm gonna open up my alcohol wipes pack and place that on the side. I'm also gonna grab my catheter, place this like that, and slowly pull this out, trying not to move this around too much. Dispose of this. Okay. Next, I'm going to just place this on the tray. I'm gonna get the lubricant out, and I would place this all over here. But I'm not gonna actually take it out because I don't want to hurt that. Next, I'm going to use the catheter and lubricate it, and I'm gonna lubricate about 5 to 7 inches. So lubricate, and then I'm gonna leave the catheter in there as well. Next, I'm going to take the saline water and attach that to this balloon and place that back in there. Okay, next I am going to, with my non-dominant hand, I'm going to hold on to the perineum and use these swabs to clean from the medius to the anus, and dispose. And I'm only going to do one swab from the meatus to the anus and then the urethra, and dispose. Next, I'm going to take the urinary catheter, and I'm going to hold it about 2 to 3 inches from the tip, and I'm going to make sure it's lubricated. Okay. Also, I'm going to have my patient bear down like she's about to void, and I'm also going to ask my patient to take deep breaths. Also, I forgot to mention, before doing the swabs, I would ask my patient if they're allergic to the antiseptic, the solution. So yeah, now I'm gonna proceed with inserting the catheter. So I'm just going to slowly start inserting it, and I would insert about 2 to 5 inches deep. And once I see the urine in the tube, I will proceed about another 2 to 5 centimeters. This one's not gonna go in anymore. Okay, once it's inserted, I am going to inflate it with the saline water. Okay, and I can tug a little bit to just double check that it's in there tightly. And I will remove this and dispose. Then I'm gonna remove my gloves and perform hand hygiene. Put on another pair of clean gloves. And remove all this. Dispose this first. I don't want to rip it because this is the only one I have. Okay. Next, I don't have the lock, but I would clean the thigh area and apply the lock for the catheter. But for right now, I am just going to hang this bag lower than the body on the side of the bed. Then I'm going to cover the patient back up and place the patient in a comfortable position and dispose of any of these drapes that I use. and make sure the call light is next to the patient's bed. Remove my gloves, perform hand hygiene, and that's all. Thank you.